Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to start is called brain fog and menopause. So let's explore it today. So we are going to talk about, as I said, brain fog and menopause. So I have already made a lot of videos on what is menopause, what is perimenopause, what is postmenopause, what is early menopause, what is early menopause, which is the failure of the ovaries before 40 if you get menopause. I see a lot of ladies come into my practice who are perimenopausal, have had menopause, are postmenopausal. So perimenopause can be any time, few years, 5 to 10 years before menopause up till the 1 year after the last period. So that is called perimenopause, and postmenopause is after 1 year of the menopause. A lady is called postmenopausal. Ladies do complain about a lot of mental health symptoms. One of them, the most that concerns them, and they actually start thinking on the lines of dementia, is brain fog. So I have been addressing this issue for a long time now, and I really want to share 1 or 2 articles with you guys to understand the importance of perimenopause, postmenopause, and its connection with the brain fog, and what is the brain fog itself, okay? So it says that as menopause approaches, a lot of women experience fogginess and forgetfulness. Researchers in Australia are now investigating why. Nearly 2/3 of women experience brain fog as a symptom of menopause. It may involve difficulty remembering words or names, struggling to concentrate, or the common scenario of walking into a room for a particular reason but then completely forgetting what that reason was. So these are all the symptoms of brain fog. These experiences can feel frightening for at least some women who worry they may be developing dementia. What's more, they can also have an impact on a woman's quality of life, self-esteem, and work. The good news is, in most cases, there is no need for alarm. As stated, many women experience brain fog at midlife, and chances are it's only temporary, and it's only because of fluctuating levels of estrogen, especially the decreasing levels of estrogen, which causes the brain fog. The even better news is that researchers in Australia are now trying to better understand brain fog and are investigating why these cognition changes occur. Cognitive changes are those related to mental processes such as thinking, remembering, or understanding. They want to find out if there is a link between brain fog and other menopausal symptoms like sleep difficulties, mood changes, or vasomotor changes such as hot flushes and night sweats. Forgetfulness and fogginess can be highly concerning for many women, says Associate Professor Caroline Gerwich, a clinical neuropsychologist. There is an area that needs research, and it's so timely because it is now being recognized that to keep women in the workplace in the prime of their careers, which happens to coincide with menopause, they need to be supported at this time. So what is brain fog? Brain fog is not a medical term, okay? But it's universally considered to be just right for describing some of the difficulties that women can experience during menopause. Fluctuating hormones and stresses in a woman's life, juggling hormonally changed teenage children, caring for elderly parents, and balancing busy careers while running their homes have been suggested as key factors contributing to brain fog. So this is what we need to address, that when it's perimenopausal period, so you can be having perfectly normal periods, but you still can be in the perimenopause period. Like you can still be in the perimenopause region, especially after 40 years of age, because the actual menopausal average age is 51 in Australia. But after 40, if you start experiencing, if before 40 you've had any issues with your ovaries, you've had the ovaries removed, or you've had early premature ovarian failure, that's another story. You could be in early menopause even before 40, but after 40, if you start experiencing these symptoms that I've just mentioned, it could very well be menopause. Go to your GP, get on HRT, get on hormone replacement if you have no contraindications. Blood levels can sometimes help, can sometimes not help. They can also be very, very normal. Your periods can be normal, but you can still be perimenopausal. So go talk to your doctor and get some estrogen, get some help, and if needed, we can do because some of the anti-anxiety and antidepressant medications are now actually part of the menopausal therapy. So they are good for vasomotor symptoms like hot flushes and night sweats, and they are also good for mood symptoms. So apart from estrogen, you can also get the antidepressants and anti-anxiety medications prescribed for you for not only the mood symptoms, but also for the menopausal symptoms. Not only the mood-related menopausal symptoms, but also for vasomotor symptoms like hot flushes and night sweats. So do talk to your doctor.